Welcome to our second edition of Clinical Conversations with me, David Durbin, and
Natalie Jones, Senior Vice President of Clinical Practice and Innovation.
how about this, Natalie? We already have our first guest. You went viral with pizza parties, and people wanted to know what the heck it is you were doing. So let's welcome in Drew Carter. Drew, you're our first official guest. How about that?
Well, thank you. It's a treat to be here with you two.
All right, Drew, what's your story? Where are you from? Why are you here with us?
So I'm CEO and co-founder of a company called Whistle Rewards. I used to run the biggest rewards and recognition platform in the world. We provided the points programs and the catalogs and things like that, trying to drive employee engagement and really help everyone feel a part of the team and that they're valued and appreciated. But what I found was those programs were tired, catalogs were kind of old and rusty. The industry needed a reboot. So I left about 4 years ago and created this company, Whistle Rewards. And our goal was to figure out if we could create a better mousetrap where we especially focused on people in the field, like healthcare professionals. So that's where we are. That's what we're doing. I'll tell you more about that.
All right, so with that as a backdrop, Natalie, you and I started working together when I joined about a year ago, but we wanted to do something different as it related to engagement, just in time recognition. So during Nurses Month, you decided to do something different, which is partner with Drew. Can you walk backwards and help people understand what was the problem statement? What were you trying to solve for other than, the pizza party?
Yes, coming into Prolink, I spent a lot of time really studying behaviors of our clinicians and talking with our recruiters, our recruiting managers, our CRMs, our clinicians themselves on what is it that really drives retention and loyalty for them in the travel nurse industry, but not necessarily just isolated to that, just in healthcare overall. So, coming out of the pandemic, we noticed that there were a number of clinicians that not only were we necessarily losing out of the bedside or but out of nursing overall. And so much of that had to do with their experience and our need to really address retention in a different way that was more meaningful, more timely, and really tied very quickly back to the behavior that got the attention, that got the recognition in the first way. And so, as we had this introduction to Drew, you're going to learn so much more about that. This platform had the opportunity for us to solve for, of course, the gift for Nurses Week, but how could we use this experience to learn from it and think about how we could use it from a reward and recognition standpoint, really thinking about some partnerships and different things from an onboarding standpoint, and then also with reimbursements. So the platform has so many opportunities. We started here and we learned a lot.
And so, Natalie, when we made the decision to partner, what were the key things that you were looking for? And then, Drew, how did you help us think about that?
One of the things we heard from our clinicians, sort of subjectively through focus groups and talking with them, is that they wanted the opportunity to get, of course, money. But rather than that, they wanted to also have the ability to buy the things or to actually have access to stores that they could purchase swag, that they could have things that were actually branded with ProLink's brand. And so, really trying to solve for that. But also, sometimes our recognition programs were taking so long. You had a Daisy Award a month ago, and you're actually delivering the Daisy 4 to 6 weeks after the occurrence. And sometimes the clinician couldn't remember the patient, couldn't remember the family or the event. They knew they did something good, but being able to really tie that back very quickly was just one of those things that we were trying to solve for. So leveraging technology in a much different way and not just sending a digital gift card, this platform allowed us to do something a lot different and to track the behavior and track the usage of it as well.
When I was introduced to ProLink, part of what was really compelling about working with you guys was your real focus on your people, your travelers, and on their experience, And what I saw was a partner who really wanted to lean in. So when we started working with y'all, it wasn't just, hey, I need a trinket. It was, hey, how can I drive the experience? How can I make people feel the appreciation that I want to send to them? A lot of our work with Prolink has been really understanding what's that traveler's experience. And everyone has kind of a different path. Even though they might look kind of similar from the outside, often a 13-week assignment, the path to get there and through that is really pretty unique. So one of the funny things that I see is in regular life, right, outside work, we all live into a lot of behavioral science when we think about trying to get people to do stuff. If someone does something great and then a month later you get a thank you, you're always, you're happy to get the thank you, but gosh, you're like, I guess I'll pretend I know what you're talking about, right? Because so much has passed. And especially as nurses, you're so busy. So what we did was look into, what do you guys want to do? What's the experience we're trying to drive? And how can we live into that? And so we can unpack it later if you want, but we have 6 components that we feel strongly based on our behavioral sciences leader that really drive the feelings of appreciation and value. And so we leaned into all 6. And, they start really with that behavior and timing, being as immediate as you can.
And Drew and Natalie both, as we worked on this together, the thing that I was struck by, and I know we've been teasing about pizza, and I'll tease a little bit about Starbucks. Look, I'm a Starbucks person. I love Starbucks. If you give a gift card to Starbucks to somebody who doesn't like Starbucks or doesn't use Starbucks, it loses its impact, it loses its value. And that's one of the things that we spent a lot of time talking about, Natalie, talking about Drew, is how do we do this in such a way? And it's not even the monetary value, right? Because we're not changing anybody's life.
Absolutely. Outside of the freedom to choose, even when we looked at this, we have 3, 4 generations working today, right? And so the ability to make your own choice was one piece of it, but the digital nature in which you've got, I've pulled up my ProLink card here,
Yeah.
the digital nature in which we all work and live today is just so different. So ease of use and our ability to also gain feedback and understand how our clinicians were using the cards was also another thing, because it allowed us to gather more information. Many of them did end up finding their way to a Starbucks or finding their way to a Chick-fil-A or finding their way to McDonald's. Whatever that was, it still was their choice and their ability to be able to have that ease of use. I was going through an exercise this weekend as I was thinking about like all the gift cards that I have. And I have 6 gift cards, 2 of which are like 8 years old.
There's still any value on them? Don't they
I
expire
know I'm going
eventually?
to find out. I was hoping to prep for today and test it. But one of them is for like a mall, like $40 for the mall. And I'm like, I don't even know if there's any money on here, but I'm like, why didn't I upload that to my phone so that I can then go and really use it? And, as I pulled the gift cards out, I did reminisce on what did I do for my team to give me these? Why did they feel like this was the necessary way to thank me? I think just the immediate nature, as I said, and being able to track your spending too in a different way. I think people in all generations are very interested in that. And we found that everything from our millennials to baby boomers to Gen Xers have used this card in our population.
And Durbin, let me test you. Do you know how much profit Starbucks recognized in 2023 from gift cards that people never redeemed? Basically, from Natalie.
No,
But
we're gonna go viral with our Starbucks commentary. I have no idea, Drew.
$211 million of profit
Wow.
from gift cards that will never be used, even though they don't technically expire. We're not hating on Starbucks, but the thing is, a lot of people feel like they want to curate a selection of something, right? I want to create a little catalog of things that somebody else can pick from. And man, that just does not work, right? The curating stuff worked, maybe in 1981, but now we have the internet, and now we've been trained by places like Amazon. You should be able to have anything you want, and basically you should have it immediately. And so that's kind of what us as people, as human beings, that's what we expect now. I don't expect to be curated. I expect to kind of to be able to make my own choices and to have my own autonomy. That's a big part of what we're trying to provide with the Whistle card is let me put Prolink on it, right? So it's got your branding. It's all about you. But let me then say thank you for taking that second shift. I'd love to buy you a cup of coffee, but actually you get $8. And so if what you really need to do is grab McDonald's breakfast for your 2 kids, great. I want you to do that. I'm not trying to force you someplace. I'm trying to tell you I appreciate you. And there's nothing better than saying, here's something, I think you might like it, but do what you want. And if I can, Durbin, if I can show it, a little diagram really quick. These are our 6 design principles that we brought to Prolink about creating a good rewards and recognition system. And these are the things that help people feel valued. And I'll just go through them quickly. It's focusing on behaviors, not just outcomes. Being immediate with the timing. It's given people the flexibility of cash. Salience is the nerdiest term here. It just means how can I get this to rattle around in your brain the most so that you're feeling like, gosh, these people, it's Prolink. It's my recruiter, it's my manager. These people care about me. It's being able to do it frequently, and it's making it simple for that nurse so that he or she doesn't have to jump through a bunch of hoops, but I did a thing, I got a reward, and man, I'm taking advantage of it all right in a row.
So if I can interject, Drew, one of the things that Natalie and I talk a lot here about is being a very clinical forward organization and recognizing that, look, it's a crowded space. There's a lot of people who say they do what we do, whether it's workforce or travel nurse. The reality is those of us that do it the best think about how do we make this to be a world-class experience for our talent so that our client has a world-class experience. And one of the things I was struck by was the feedback that we got from our talent on this. Like, legitimately, the response was overwhelming about, hey, thank you for recognizing me in a way that allows me to do what I want to do when I want to do it. What did that response rate sound like? What was the feedback?
We monitor the engagement of our programs all the time. It's super critical to us. And some of the comments that I thought were especially striking were when we look at the feedback we got. One of the things I saw was so many people said, oh my gosh, thank you, because I could use this reward for X, which is super important to me. But every one of those fill in the blanks was different. So, it was thank you because I got to spend this on my family, because spending time with my family is the most important. Thank you because, I could buy a stethoscope because that's what really I needed, or blah, blah, blah. So I love seeing everyone kind of say, yeah, I was able to live into this in my own way, and that made it special that we never could have done otherwise. That was something that I thought was striking. Natalie, what'd you see on your side?
I agree. I think, we had a saying where I came from, show me the money. People in all generations just appreciate the cash value, and to your point, being able to spend it on what they want, being able to reinvest in those things that may be brand recognitions and stores and things like that. And so that was one of our huge takeaways coming out of the pilot, is that our clinicians wanted that ability to reinvest and purchase things that were branded for Prolink. And so because this is app-based, in many ways, we had the ability to do shout outs and to actually engage socially within a platform across our entire enterprise. And we use this for our clinicians within Prolink as well as our talent. And so that camaraderie and that congratulations and that, happy nurses month clinician to clinician was also really meaningful as well, and something that people also called out as a huge part of their experience.
And that's really part of, Natalie, you and I could have done a couple of different things after our first, viral experience of clinical conversations. I just, one of these days we're gonna go viral. But the part that people were genuinely interested in, and the reason why we actually chose to do this, was the reality is our clients know this part of the journey is a struggle. How do you engage? How do you retain? How do you deliver recognition in a way that is not what we've historically done? Because the reality is it can't be, right? That the motivators are different. Drew, you talked about this a lot. And the fun part about doing this and talking about this is we are actually attempting to solve a problem with clinical people and nurses in the same way our clients are. So as much as we're excited about what we're doing, we also want to make sure people understand that we get it. We understand why this is a problem. And Natalie, I know you're in front of a lot of clients, you're in front of a lot of your peers. How much of the quote pizza party thing is really a problem? You and I were together with a client and we laughed out loud about this, but to the extent that you can add more color than I can because you are a clinician, what is it? What are they struggling with right now?
I think there are several things. And don't get us wrong, pizza parties, donuts in the morning,
Sure.
coffee, whatever you bring in, the clinicians appreciate it. But it's the ability to scale it and track it and have analytics that can track back and get feedback to who is everyone getting it. That was the other piece of it is, when leaders look at engaging and recognizing, of course, cost comes to mind. Many times they're spending their own money and then being reimbursed. I've heard that from everywhere from CEOs to CNOs to frontline nurse managers, and lived it myself. Outside of that, though, when you think about a program like this, it's the consolidated nature of it, and creating equity within your department and within your organization so that you're driving for behaviors and you're driving for results, and you're able to connect this from a meaningful recognition program and tie it back to retention and engagement in a different way. And so this platform, although we talk so much about the recognition and the cash reward piece associated with this card, there's so much more to it that really allows an organization to use it and to create a program that would really tie for those outcomes and tie it back to outcomes, I should say.
And Natalie, one of the things that I observe, at least, is when you talk about scaling a program, I think healthcare organizations tend to get a little sideways with things like the pizza party, because as an administrator, you want to do something nice for your people. You want them to feel appreciated. The pizza party is almost the easy button, right? It's not that you're not doing something, but it's like, well, let's do this. We know how to do it. It's kind of simple. It doesn't take a lot of stuff. But because of that, it also can seem impersonal. It can seem a little bit like, well, how many of these are we going to do? If that's the only thing, it starts to get a little stale. And that is one of the big challenges when you're trying to orchestrate, especially a large organization. Gosh, as an administrator, you're thinking, well, what are my choices here? And so one of the aspects with our platform, amongst all the nice things you said about it, is we allow you to decentralize that. So, if you've got departments, you can shift a budget to that department to say, great, you can figure out what you do. Everybody's going to get the same budget. If you want to spend yours in this way for your department because of some reason, great, you do that. That can create a scale ability because I don't have one person or a centralized group trying to decide things for people all over. I can send that responsibility out, have them act on it. As you move out in a more decentralized way, you tend to get more personal because you get closer to the people, right? And as you get closer, you have better relationships. You know the people better. You can say, "Oh, great, this group will love this." I'm on this schedule or whatever. And I think that really helps to create authenticity, right? That we really care.
Natalie, let me follow up on the question I just asked about, what's your peer group up to? What are they trying to solve for? One of the things we know right now in healthcare is, look, budgets are tight. It's hard to find ways to do things like this. One of the things you and I talked about was, how do we do this in such a way that we have better line of sight to actually what we're doing and what's the impact? Can you talk a little bit about ROI? Because let's be honest, this is a discretionary investment, and we got to find ways to help not only us at Prolink but our clients to find an easier path to make sure that something like this makes sense.
Absolutely. And typically, most of my peers are using 1.5 of a nurse's salary or a clinician or FTE salary to track and report out turnover cost. And in a program like this, it may seem like there is a cost on the front end, and there is a cost on the front end, but the return on investment is great when you think about what the investment actually is. Sherm would say that about 1% of your total revenue for your organization should be reinvested back in a reward and recognition program. And so only a fraction of that is what we would be talking about for a program like this, and really being able to see everything from 2 percentage points to 10 percentage points in improvement in retention. It just depends on how you structure it.
And Drew, isn't it fair to say, and one of the things that we were struck by as we started work with you, sometimes it's just really hard to get your arms around what you're actually doing. And so there's some elements of this partnership that enable that accountability and the tracking. Can you talk a little bit about why we were so excited about the transparency we now have as it relates to what we're doing and where we're spending and who's spending?
Yeah, absolutely. And for the CFO folks out there, there's a vagueness or a lack of clarity on both the cost and the return side. On the cost side, there's money that's allocated or resources that are allocated that are never really accounted for very well. Little funds that go for this and that, a gift or something sent out, and very little recording done for that. But also on the cost side, there's not a line item in anyone's P&L that says, voluntary attrition cost, right? It's just the cost of HR, and it's the cost of training that's kind of spread out everywhere. But for those companies that are really looking at their turnover, they really can't assign that value. Just like Natalie said, 150% of a nurse's salary is that cost of turnover. So part of our platform is we provide complete traceability of every expense. Where did it go? From whom to whom? Did it get spent? If not, let's recycle those dollars, making it even more cost effective. It's weird to say, but we are less expensive than gift cards, which you think, how is that possible? But that's because we don't have that waste of the $100 gift card that was given away that was never used. So there's that, but then there's also the value that comes out of that. And just like Natalie was saying, we're seeing up to 10% and sometimes higher reduction of voluntary attrition. And for large healthcare organizations, that is millions, maybe tens of millions of expense. As that reduces, that provides more funds for the rest of the organization. And it's exciting. I call it the win-win-win, right? When the clinician, it feels more valued, the organization is more efficient and profitable, and on the outside come better outcomes for the patients. It's a win for everyone. That's really the trifecta. And I did want to add one other thing. I work with lots of clients throughout the industry, and one of the reasons that I enjoy working with you two and Prolink in general so much is you all stand above really everyone I've worked with in the way you address the market. You of course have a commercial, goal, but what I see you lead with is, let's try to do the right thing for our clients. Let's do that first, which is the right thing for their clinicians, their travelers, their employees. Let's do that first. And then what'll fall out on the end is a successful business at Prolink. And that's such an admirable position to take. It's what makes me excited to work with you. And I really, really respect you guys for it.
Well, thank you, Drew. That's nice to say. That's part of what Natalie and I and Tony and Mike and everybody else who's part of this organization really gets up every day trying to do is say, hey, you take care of your client, you take care of your talent, the business outcome follows. So appreciate that. Yeah, and maybe it's the same final question for both of you. And one of the things, like Drew, we talked to you about this as we were preparing for it. The goal of these is really to be a conversation. Our desire is to not be scripted. We really want people to understand we're out here thinking about how do we solve real life problems. And so, Natalie, I'll go to you after Drew because I want you to have the last word, right? Drew, if you think about one thing that you want people to take away from the work that you've been doing, whether it was at your prior place where it was a different model to what you're doing now, what do you want people to walk away with and understand, hey, you can actually impact this?
I think the biggest challenge that I've seen is people aren't aware that there's a better mousetrap out there. And folks trying to create that feeling of appreciation and value sort of look around and they think, well, I don't know, I've got a pizza party or, appreciation rocks or something like that. I'll just choose the best of these. And I think the point is there is a better option. And if you really think through, what do you want that experience to be? And get away from what's administratively convenient, there is a better solution that really can focus on the experience and the emotional feelings of those people. Because just like I mentioned in the beginning, we treat our families and our friends with so much empathy, and we get to work and somehow kind of feel like we're all Spock from Star Trek. Let's get back to maybe we're all a little more Captain Kirk than Spock.
Follow that one, Natalie.
Wow. Well, I agree, Drew. I think that many times in the clinical world, we have so many self imposed barriers. And I too walked into this conversation thinking this is a points program, this is just very narrow minded. And this platform allowed us a unified approach to really think through people scenarios, through acquisition, engagement, and rewards that allows something that's much more powerful and resilient. And when I think about that and you position it in a way as we have within our organization, and we've got clinicians that are touching almost all 50 states. So thinking about it from a loyalty standpoint, a branding standpoint, a resiliency and well-being standpoint, how we can create more partnerships and connectedness and connecting behaviors and connecting positivity through a platform like this. And then even thinking about it from an ongoing onboarding and professional development standpoint is one of the things that my team has thought through. It's a one-stop shop when it comes to all things engagement, retention, and at the end of the day, really truly supporting our clinicians at the front line who put their lives out there every day to support clients, communities, patients, families, and have signed up for this. So what other way would we want to thank them and create something that is meaningful and ties back to recognition for each of them?
And I'm glad you ended there because that's what I wanted to say, Natalie, was to our talent that went through this with us. Gosh, thank you. The feedback and the affirmation that we were heading down a good path. Our response rate was north of 95%. And you just don't see that. So what our talent told us was we were headed down the right path. And sometimes innovation comes in sneaky, easy ways, right? Where you just don't have to overcomplicate it. So, Drew, truly, thank you for the partnership. We're excited to have you as a partner, not only for what we do here at Prolink, but with our talent. I appreciate you being our first guest. And And Natalie, as always, thank you for pushing us to be truly a clinical forward organization. And, Drew, we'll have you on again sometime, maybe with another partner where we bring all this together in a slightly different way. So look forward to our next conversation. Talk to everybody soon.